Now, for this very next thing we are discussing, is more of like we're actually trying to answer a question. Why is it that pediatric emergencies are unique? So they asked us to discuss why pediatrics emergencies are unique. Okay, so let's quickly look at that. So pediatrics emergencies are unique. Okay, so because children have distinct anatomical features, different physiological features, different developmental features, different psychosocial features. Do you understand? So this makes them unique. Okay, so talking about the anatomical and the physiological differences now, their airways are smaller, so they are more easily to obstruct. Okay, large tongue and floppy epiglottis increase the risk of airway compromise. Their respiratory system, there's a higher metabolic rate, so there's faster oxygen consumption. Circulatory system, there's smaller blood volume. Do you understand? So if they lose blood due to bleeding, it can cause shock in them very fast. Then thermoregulation, they have a large surface area body relative to the body mass, so they are prone to losing temperatures quickly. So hypothermia can set in. Then their immune system is weak. Okay, so there's higher risks of infections penetrating through and all of that. So developmental and age-related factors, communication barriers. Children can't really describe what is wrong with them accurately. Okay, variability presentations. Same disease can present differently based on which stage the child is. Then growth considerations. Emergencies may now affect the child later on in life. Okay, so all these fears are always there. So psychosocial and family-centered aspects, family involvement. Parents are integral to history taking. So it's the parent that was an eyewitness that usually describes what happened to the doctor. The child is there but can't really, So clinical challenges is rapid deteriorations. When children are faced with these emergencies, their life collapses so fast. Okay, so you have to be fast. Then equipment needs. The equipment you use on the child are not the same equipment you use on adults. So there's a need for pediatric equipment, which sometimes might be challenging. Then also their drug dosing is special. Okay, don't give the same doses to a child, same doses to an adult. All right.